Doctor, great to have you. So I do want to get to that. I also have to ask you about what Trump did yesterday. He had that executive order about how the U.S. will be pulling out of the World Health Organization. So maybe a two-part question, two different topics. Take that first about the World Health Organization, and then your recommendations on the flu shot. Good morning, by the way.
Doctors strongly support Trump in pulling out of the WHO. They greatly misled us through the pandemic through their what's called national focal points. We had one in Washington called PAHO, or the Pan American Health Organization, that sent out a whole series of false health messages that misled us through the pandemic. So great to be out of the WHO. I think you're going to see other member states withdraw.
And Dr. McCullough, weren't we putting a ton of money into the WHO in comparison to other countries?
That's what Trump said. It was greatly disproportional based on the population size of the country. He compared the United States to China, and it was terrible. So it's great to be out of the WHO. I never followed them as a doctor anyway.
Okay, well, we want some doctor questions this morning. We want to know, why has the flu vaccine been so ineffective this year?
Well, a good point. So people who take the flu vaccine, they get influenza anyway. They need to be ready. Remember, there's home tests now. You can get a home test on Amazon very affordably and just test at home if you want to see if it's influenza. Wellness company Black Contagion Kit has everything you need to treat influenza. If you started early with oseltamivir in the treatment, one can get through influenza readily. The main goal with influenza is to simply manage it at home and not end up in the hospital. And that's what we're all about, the wellness company.
So tell me a little bit about people that don't want to take that flu shot. I got to be honest with you, I don't take it. I mean, I don't. And they always tell me to take it, and I don't do it. Oh, you're shaking your head. Go ahead. Tell me.
Yeah, I quit taking them, too. I was impressed by a randomized trial that I put out on Courageous Discourse Substack. It was happening to me. If you take a flu shot, you're more likely to get the common cold during the flu season. Yeah, so I was sick almost every month and I had taken 40 flu shots over the course of my career to be on medical staff. I'm done taking flu shots. If I get influenza, I'll just treat it readily with one of the wellness company Black Contagion kits and get through it.
Sounds like a good idea. Well, we've been watching the first of Donald Trump's nominees face Senate questioning. Some of the hearings have been quite contentious. Do you expect that Senate Democrats will push RFK Jr. as hard as they've pushed someone like Pete Hegseth?
I think they're going to push harder. That's going to come up this week. And you can see the types of questions where they're trying to pin them down. And one of the questioners tried to get Pam Biani to, give the conditions by which she would resign from the position. Those are very inappropriate questions by our representatives. I think everybody should give feedback to our representatives that the questions need to be constructive so we can fully understand the positions of these nominees, not these types of derisive, long questions that are making statements and then trying to pin candidates down on future scenarios.
Yeah, Dr. McCullough, we have about 30 seconds left. I'm curious, with the Trump administration now officially underway, what do you think President Trump can do immediately to improve our nation's healthcare system? I mean, in 2017, they spent the first 6 months trying to overturn Obamacare, and then John McCain did the big thumbs down, and it didn't quite work out. What do you say this time around?
This mantra of make America healthy again really is going to pick up steam. Trump needs to respond to senior expert advisors on where we need to go in healthcare. Wellness company, we have a tremendous set of ideas and tools to help keep people healthy without prescription drugs.
Sounds wonderful. And we'll be counting on you in the months ahead. Dr. Peter McCullough, thank you so much for being here this morning.
Thank you.
Thank you.